Starting a successful IV on a rolling vein begins long before the needle's touch. Always start with thorough WHO hand hygiene. Prepare your sterile supplies, ensuring you select the appropriate gauge catheter and skin antisepsis. Apply the tourniquet firmly to dilate the target vessels on the patient's arm. Decontaminate the skin using a chlorhexidine friction scrub for at least 30 seconds following WHO safety protocols. Allow the disinfectant to air dry completely to maximize infection prevention and reduce skin sting. Here's the key tip. Use your non-dominant thumb to pull distal skin traction firmly downward. This locks that rolling vein into place. With continuous tension, the vein is stabilized and cannot roll away during penetration. Approach the stabilized vein direct on at a low 10 to 15 degree angle. Enter smoothly through the skin right into the vein center. The skin traction stops lateral slipping. Once you see the blood flashback in the hub chamber, lower your angle slightly. Smoothly advance the plastic catheter off the stylet directly into the vessel lumen. Release the tourniquet and apply digital vein occlusion above the tip to control blood flow. Engage the needle safety mechanism immediately and drop the sharp directly into an approved biohazard container. Secure the hub with a sterile, transparent dressing. Label the site, and your IV access is complete.